Do flu antivirals actually work? Imagine battling the flu and wondering if those medications your doctor prescribes really make a difference. Well, let's explore what science says about flu antivirals and how they fit into managing influenza. Influenza is a contagious respiratory illness caused by influenza viruses, mainly types A and B. While getting vaccinated is the best way to prevent the flu, antivirals are available to treat symptoms once you're sick. But do these medications truly work? The answer is yes, but with some important nuances. Flu antivirals are prescription drugs designed to interfere with the virus's ability to multiply in your body. The most common ones include oseltamivir, known as Tamiflu, zanamivir or Relenza, paramivir or Rapivab, and baloxavir marbixil, called Xofluza. These drugs are effective against both influenza A and B viruses. When taken early, preferably within 48 hours of symptoms starting, they can shorten how long you feel sick. For example, baloxavir can reduce symptom duration by about 1 day, while oseltamivir and zanamivir may cut symptoms by less than a day. Starting treatment within the first 24 hours offers the best chance for these benefits, especially in children, where early treatment can cut symptoms by up to 3 days. Beyond easing symptoms, antivirals may help prevent serious complications. For people at high risk, like the elderly, young children, or those with other health issues, these medications might lower the chance of hospitalization. Some studies suggest that oseltamivir could be linked to a lower risk of death in hospitalized patients, but the evidence isn't definitive. They also help prevent secondary bacterial infections such as pneumonia or ear infections, reducing the need for antibiotics in some cases. However, antivirals aren't a magic cure. They work best when used early and mainly benefit those at higher risk of severe illness. For healthy people with mild flu, the benefit in preventing serious outcomes is less clear. Side effects are generally mild but can include nausea and vomiting, especially with oseltamivir. There is also concern about the development of antiviral resistance, particularly with baloxavir, which has been associated with resistance in about 10% of treated patients. This means the virus can sometimes adapt and become less responsive to the medication. Medical guidelines from organizations like the Centers for Disease Control and Prevention and the Infectious Diseases Society of America recommend antiviral treatment for hospitalized patients, those with severe or worsening symptoms, and individuals at high risk of complications. The key is to start treatment as soon as possible after symptoms appear, without waiting for lab confirmation if the person is high risk. Experts agree that antivirals do provide a real, though modest, benefit in reducing how long and how severely you experience the flu. They are most effective when started early and are particularly helpful for vulnerable groups. But they are not a substitute for vaccination, which remains the most effective way to prevent the flu altogether. If you suspect you have the flu, especially if you're at high risk, contact your healthcare provider promptly. They can assess whether antivirals are appropriate for you. Remember, never take these medications without a prescription, and always follow your provider's instructions. Using antivirals early can help you recover faster and reduce your chances of complications, but they are just one part of managing flu illness. Always seek personalized medical advice to find the best approach for your health.